cut whatever you want.
Come over here this side. Thank you for coming.
Hello, I'm Senator Ted Lieu, and I'm here for two reasons. One is to highlight the extreme dangerousness of tanning in an indoor tanning salon, and second is to urge Governor Brown to sign my legislation, Senate Bill 746, which would ban tanning use for anyone under the age of 18. The medical evidence is now conclusive. Tanning beds kill people. And in 2009, the World Health Organization labeled tanning beds as a level 1 carcinogen, the same level as cigarettes or plutonium. FDA and the U.S. Department of Health and Human Services labels it as one of the highest level carcinogens. Even one use of a tanning bed will increase your chances of melanoma. And in California, a Stanford study recently concluded showing that young women, in terms of melanoma rates, have recently doubled. In LA County, we have a graph here that shows there are more indoor tanning salons than either McDonald's or Starbucks. And this is a very big problem because it's driving up healthcare costs and it is resulting in unnecessary death. There is an alternative. There is spray tanning, which is completely non-harmful, and we're simply saying for people under the age of 18, please go use a spray tan or use a lotion or a cream, and that could save your life. I have here doctors as well as a cancer survivor, and let me first introduce Dr. Robert Adler, who is Vice Chair, Department of Pediatrics, Director of Medical Education at Children's Hospital, and let me thank Children's Hospital for hosting this event and all they have done to help Los Angeles. Dr. Adler?
Thank you, Senator, and thank you for this very important legislative action that we're fully supportive of here at Children's Hospital. And in fact, the American Academy of Pediatrics, which represents over 60,000 physicians, just came out with a statement this year recommending that we ban all use of the sun tanning parlors for all individuals under the age 18. The dangers are recognized. We're well aware of it. We know that it increases the chance of melanomas, which is the most common cancer now among young adults. This is a very serious issue, and we're committed to doing everything we can to support this legislative effort. Thank you.
Thank you, Dr. Adler. And next we have Dr. Linda Wong, Regional Chief for Dermatology for Kaiser.
Thank you, Senator Lieu, for this opportunity to present my viewpoint here. I'm Dr. Linda Wong, and I'm in the Regional Chief of Dermatology for the Southern California Kaiser Permanente Medical Program. I'm also on the Board of Directors of the California Society of Dermatology and Dermatological Surgery, and am a volunteer pediatric dermatologist here at Children's Hospital. I wanted to share you my story that in my years of practice, I've noticed that my skin cancer patients are appearing younger. And they often express regrets of if I had known to apply my sunblock more frequently, if I had known to stay out of the sun more frequently, if I had known to stay out of the tanning beds. It's not worth having that tan to pay the high price of getting multiple surgeries that are painful and that can result in permanent scars that are very unsightly. And if you're one of the lucky ones that get diagnosed with melanoma at an early stage, you still have the fear of recurrence years later after the fact. In my practice, I just recently met a young woman, 35-year-old mother with 3 children. She was recently diagnosed with metastatic melanoma 7 years after the primary melanoma was excised. If we had offered early prevention and education for this patient, she would not have to worry about who would be taking care of my children after she is gone. If we know that tanning parlor use in childhood increases your risk of skin cancer or melanoma 75% times higher than the average person, why do we permit our young people, our most vulnerable patients, to have this increased risk? So I come before you now as a physician and a concerned parent to urge Governor Brown to sign this important bill to protect our children. Thank you.
Thank you, Dr. Wong. And next we have Dr. Jenny Kim, a board-certified dermatologist from UCLA.
Thank you for this opportunity to join you this morning. My name is Dr. Jenny Kim. I'm an associate professor of dermatology and medicine at UCLA, a board-certified dermatologist and a Mohs micrographic surgeon, and a chief of dermatology at the Greater Los Angeles Healthcare System Veterans Affairs. First, I'd like to congratulate Senator Liu, the California Society for Dermatology and Dermatology Surgery, and also the AIM at Melanoma Foundation for taking a leadership and making this important healthcare issue come alive. As a Mohs surgeon, I see often a young person who develops skin cancer after extensive use of UV radiation, both from the sun and also from tanning booths. And there's a misconception that if the UV radiation is not from the sun, that it's safe. But we know that there's no UV radiation that's safe. The World Health Organization has come out to state that UV radiation coming out from the tanning booth emit radiation that is a carcinogen. So therefore, just as our state law protects our children and prohibit the sales of alcohol and tobacco, I think it's our duty to protect California minors from UV radiation exposure that's a carcinogen. So I urge Governor Brown to sign the Senate Bill 746 to decrease the future incidence of skin cancers in California. Thank you for this opportunity.
Thank you. And we have next Katiana Nightingale, who will talk to you about her experiences with tanning beds as well as alternatives.
Senator Liu and members of the press, thanks for showing up today. And I feel honored to be able to speak on behalf of all of those voices that can no longer be heard because they have suffered from melanoma. It's a very life-threatening and disfiguring disease, and I think that teenagers today don't realize how dangerous a visit to a tanning bed can be. There are so many healthy options out there in the marketplace right now that can give you a beautiful tan. So it really doesn't make sense to go to a tanning bed. If you talk to any of the victims that I have spoken with, they're just imploring people to get the message out. Please stay out of tanning beds. I think it's really fitting that we're standing here in front of Children's Hospital today. These are really brave souls fighting for their lives, and there's no reason in the world that we should have any more young people diagnosed with cancer. Cancer is the big C. It's a big deal. I think it's time that the governor speak out and be a beacon of light to the rest of the community and to the rest of the country and spearhead this legislation by signing this bill. I used to use tanning beds. I thought it was a novel concept. My mother, in fact, encouraged me to use tanning beds when I was 15. I was diagnosed with malignant melanoma when I was 29. I was lying on a hospital operating table, and when the surgeon was cutting through my back and I could feel the blood dripping down my back, I thought, you know what, it's not worth it. This is serious, this is big time. So I started communicating with a lot of people that had contracted melanoma, and the stories they're horrific. I mean, they involve multiple skin grafts, and those are so painful, and chemotherapy treatments, and parents sitting in a doctor's office hearing those three frightful words, your child has cancer, are awful to hear. So I implore kids to get out, get the word out, sign the petitions, do what you can, but it's really, really, really important that this bill is signed. Thank you for your time.
Thank you. And let me conclude with a few facts, and then we can answer any questions. So of all women who contract cancer between the ages of 25 and 30, skin cancer is the leading cause. And the reason that cancer causes from this UV tanning is because the indoor tanning bed is far more harmful than outdoor tanning. The UV rays are far more intense and they are far more stronger, and that's why these increases you get are about 75% chances. And let me also conclude by thanking the people here, and we're here to answer any questions that you may have. And lastly, if you're watching this and you want to get a tan, just go get a spray tan. It will save your life. Any questions at all from anyone? If not, we have folks here that will answer additional questions after this. Thank you so much.